We're delighted to have you all here today, and it's great to be in person. I wanted to say thank you to our colleagues from Amnesty for arranging this. I am just meeting all of you myself personally for the first time, but I know a lot of you have had previous relationships with Human Rights Watch, so welcome back. We're honored to be having Congresswoman Grace Meng here with us soon. And we are also honored to have the UN Special Rapporteur for Toxics and Human Rights present here, Dr. Marcos Orellana. Am I pronouncing your name correctly? Okay, good. You recently presented your report at the UN General Assembly just this year in October. And I'm going to talk a little bit about that, but my summary will be brief, so I really encourage everybody to read the report. I think there was a link shared, and then there's also a QR code that you can bring it up really quickly. So we're going to start with you if you don't mind, because the conversation is coming after you, if that's okay. We were honored to have you here today. Your analysis examines how, because of gender, social expectations, as well as biological differences with the rights of women, girls, gender minorities, and indigent men all over the world, are being undercut by toxics that governments are allowing and to exist in the environment and are failing to regulate. Toxics are in our water, in the land we live on, in the food and products in our homes, and also in our bodies, in our blood, and our sperm, placentas, and breast milk. The report contains extensive examination of reproductive injustices linked to toxics. Our partner, Amnesty, and Amanda, thank you for coming back to Human Rights Watch today. Amnesty International, as well as Human Rights Watch, they did a joint report, did two separate reports this year on the same day, to make the point about how serious we want to take the U.S. government failures to regulate industry and to meet the right to health obligations that we have. Amnesty's report, which Amanda will talk about later at today's event, examined how 4 petrochemical plants owned by multinational corporations in Texas, Houston's Ship Channel regularly flouted air pollution limits with horrible immediate and cumulative impacts on health, including for pregnant people and children. These sacrifice zones, I'd love for somebody to also, that's a new term for me, so I'd love to hear more about that term. These sacrifice zones are mostly made up of communities of color. This is the embodiment of an environmental racism act. My organization, Human Rights Watch, recently did a report on fossil fuel and the petrochemical industry in Louisiana. It was in an area that has come to be known as Cancer Alley. We documented the devastation of people's health, lives, and environment. The injustices in this sacrifice zone also disproportionately affected the area's Black residents, and again, was a prime and terrible example of environmental racism. The cancer rates there were deeply upsetting, and it gets worse. Today, we're here to focus on another area of devastation. That's the impact of toxics on reproductive justice. As just one example, a study by Dr. Kimberly Terrell and colleagues at Tulane University found that more than 2,000 of the nearly 6,000 cases of low birth weights in Louisiana each year were attributable to toxic air pollution, along with over 3,500 of nearly 7,000 cases of preterm birth. That's half of all babies born in that area were being born at preterm low birth rates. An additional 1,200 cases of a low birth weight and 1,700 cases of preterm birth rates were linked to the effects of social deprivation in very low income Black neighborhoods. As a result of these combined risks, neighborhoods that were polluted, low income, and Black had extremely high risks of adverse birth outcomes, with premature birth rates as high as 25% and rates of low birth weight as high as 27%. These correspond to between 2 and 3 times the US average. The US is now leading the industrialized world in the highest rates of maternal mortality. It's worsening over the recent years with high preterm birth rates as well. This is a very sad and avoidable state of affairs in this country. I want to now introduce Dr. Orellana, who is an expert on international law and the law of human rights and the environment. His practice as a legal advisor has included work with United Nations agencies, governments, and non-governmental organizations, including on waste, chemical issues at the Basel and Minamata Conventions, and the UN Environmental Assembly and the UN Human Rights Council. He has intervened on cases before the Inter-American Court of Human Rights, the International Tribunal for the Law of the Sea, the International Center for the Settlement of Investment Disputes, and the World Trade Organization's appellate body. His practice in climate space includes representing 8 nation independent associations of Latin America and the Caribbean in negotiations with the Paris Agreement's on climate change. He's also served as the senior legal advisor to the presidency of the 25th Conference of Parties at the UN Framework Convention on Climate Change. If that's not enough, there's more to read about you in his bio on UNOHCHR website. But we just want to warmly welcome you back to Human Rights Watch. I was really excited to hear that you were with us before my time. And you set up our Human Rights Watch's Human Rights and Environment division. So thank you for that contribution. It's great to have you back. And we're happy that you want to discuss with us today your new report on toxics and gender. That was a lot, sorry. And this is not my area of expertise. So thank you. I look forward to learning as well. So over to you.
Thank you. Thank you so much. It's great to be back at Human Rights Watch after a few years. You're right. I did set up at the time a new division on environment and human rights. And I will say that it built on the great work that others in the organization had done on environmental issues. Amanda Klasing is with us in the room at the time with the Women's Rights Division, and there were others in the Health Division and other divisions. As you mentioned, the human rights special procedures, my mandate has been created by the Human Rights Council, and it is a monitoring and reporting mandate. So I report to the Human Rights Council every year, to the General Assembly every year. This year, I reported on gender and toxics. My approach to the subject matter of the mandate on toxics and human rights has been to look for and apply a human rights-based approach to hazardous substances and wastes. And what that means, among other things, is a examination of realities from the vantage point of those who suffer, and those who suffer the most in society, those who are disproportionately impacted by exposure to hazardous substances and wastes. So along those lines, my predecessor in the mandate, for example, prepared reports on workers' rights and children's rights. I prepared a report a couple of years ago on indigenous people's rights. And this year, I started to research on women and girls because of the disproportionate impacts that chemicals have on women's bodies, girls' bodies, because of biology, the susceptibility, impact, persistent organic pollutants, so-called PFAS or forever chemicals, other chemicals that mimic endocrine systems. And then also because of intersectionality, so not just biology, but the position women and girls are placed in society. I'll come back to that issue in a minute. During the research, it became quite clear that sex-based discrimination or disproportionate impacts because of sex was one lens, but the issues were broader than that. It was gender, socially constructed categories of gender that place people in certain roles in society or that have impacts on that. Some of the key findings is that the resulting gender and sex-based impacts from exposure to hazardous substances include, and I'll this list, infertility, miscarriage, stillbirth, premature birth, or low birth weight, cancers, and metabolic disorders across society. It's a lot. So a few words about intersectionality. So concurring causes of discrimination and disproportionate impacts. One of them, this is elaborated at length in the report with evidence and sources. One of them is poverty. And so the position of women and girls living in poverty means, among other things, less opportunity for literacy, which may mean less opportunities for learning about ways to prevent impacts. I'll go with, in a way, telegraphic to give a few examples. Also, people and women and girls in particular living in poverty often have low body iron stores. And what that means is that physically hazardous substances, heavy metals, for example, can enter the body and have stronger, more intense impacts in those bodies. You mentioned about sacrifice zones. This is a concept that was born in the literature that examined nuclear testing and how certain regions have become uninhabitable. It is something that my predecessors in the mandate and myself have looked at, for example, in the Republic of the Marshall Islands, as a result of US nuclear testing under a UN trusteeship when the Marshall Islands were under that regime. But the concept has expanded to address areas that are so severely polluted where a life of dignity becomes difficult or impossible. This is elaborated at length in a report that I produced in collaboration with the Special Rapporteur on Human Rights and the Environment. He presented it to the Council a couple of years ago, where we examined root causes, examples around the world, and all of this in the context of the right to live in a toxic-free environment as an element of the right to a clean, healthy, and sustainable environment. So in this regard, fence line communities exposed to inordinate amount, intolerable levels of pollution suffer disproportionately. A case in point is 50 years of struggle in Bhopal in what has been described as perhaps the most severe industrial accident in human history. And in that, it's not only the gas that was released from the facility in Bhopal that killed thousands overnight and tens of thousands in time. This is Bhopal, India, correct? But it's also the operations of the plant that for a number of years, for almost a decade, had been operating without the same safety standards as the owner and controller, Union Carbide Corporation, applied in its plants in the United States. So the double standards and the discrimination and the impact disproportionate on women and girls resulting of the Bhopal tragedy exemplifies issues of sacrifice zones. There's also, in addition to poverty and sacrifice zones, work as an intersectionality. There's a very large number of women that work in the agricultural sectors. So 60 to 70% of women in developing countries, and in high income countries, it's maybe migrants and people without that are poor, so another intersectionality, and having very few, if any, social protections. So this is a large number of proportion in society, 60 to 70% in developing countries. And the use of hazardous pesticides thus falls disproportionately on the backs of women working in the fields. Now, many of these pesticides are banned or restricted for use in their countries of origin, say the European Union member states that have banned or restricted them, but nevertheless allow for their production for export. So for these countries, the lives and health of people outside of their boundaries is less important than people within their boundaries. This is a blatant case of double standards, a blatant case of racialized exploitation that must end. The electronic sector is another area that is where discrimination is prevalent or disproportionate impacts resulting in de facto discrimination. The electronic sector employs large amount of chemicals that are mutagenic or carcinogenic or very persistent, and large number of labor force in electronic sectors, such as in Korea and other countries of Southeast Asia, East Asia and Southeast Asia, are women. Cleaning work is often considered in society as a women's work, and the use of cleaning products can similarly intersect various forms of vulnerability. I'll keep those examples to that in terms of intersectionality, given the time. I do want to say a word about endocrine disrupting chemicals, because as I mentioned at the very beginning, physiology plays a role, and human bodies are very susceptible, very sensitive to chemicals that mimic the hormones that allow for the endocrine system to work properly. And actually, hormones allow for the whole body system to work properly. And so this is a very serious threat that is facing humanity as a whole. And that's why we speak about the global triple planetary crisis of climate change that threatens to render the planet uninhabitable, of biodiversity loss, of loss of ecosystem services, and of toxic pollution that is collectively diminishing our IQ. And given the evidence, is also collectively diminishing our ability as humanity to reproduce, with disproportionate impacts in that some people and some groups can live healthy lives, reproduce, and have healthy newborns, and others cannot. So endocrine disrupting chemicals, they're found in heavy metals, persistent organic pollutants, PFAS, and so forth, hazardous pesticides, and so forth. So I will simply conclude by pointing out two basic points. One is that women's reproductive health is particularly vulnerable to chemical exposure. And because of this and the intersectionalities, governments should tackle chemical exposure in a differentiated way. Thank you for this time and this space.
Could I, we're gonna open it up for now discussion and question and answer. But a lot of us are also focused on policy change and advocacy. And I wondered, what are your primary recommendations, and how did your report go over at the UN General Assembly? I mean, was there an agreement or commitments by the General Assembly to work on goals, or what is something that we could take away and work on in our daily work on policy change?
Yeah, thank you. There's a number of recommendations that are put forward in the report. The discussion at the UNGA I thought was quite interesting in that regard. The United States, for example, made an intervention that brought in questions of access to information and so forth. And I think that is a key point to start any analysis of recommendations, is the need for disaggregated data, because without it, it is like flying without a compass. It's so very difficult to set priorities and navigate the chart course that can address these issues. So any publicly financed project should encompass a unit of measuring along disaggregated lines. Any project financed by international financial institutions, by the Global Environmental Facility, and others should do the same. And so the ability for the international community and every member state to produce data that then can enable kind of targeted, differentiated policy that I'm referring to is the starting point.
For those that joined after we got started, there is refreshments in the back of the room. There's also a bathroom just right off of this room if you need that. So please just feel at home and get up and help yourself to refreshments. or anything else you need. So now I will open it up to the room for any questions for Dr. Orellana. And also then I ask somebody to help me if there's questions online, or if we are taking questions online, you can help me with that. Okay, great. Thanks. So let's start with the room first. Yeah.
Hi, excuse me. Thanks so much for your intervention. My name is Rachel Moynihan. I'm the Deputy Director of UNFPA's Washington office, UN's Sexual and Reproductive Health Agency. I guess I'm trepidatious about the future of some of this work because we're facing a time where both environmental policy and reproductive health policy are both going to be, I think, very at risk at normative change. You know, there are people, especially, you know, coming from this country that will be interfacing with the UN that are very hostile to that information, you know, just to the basis of some of the things in this report. How do you see, you know, from where you are, the sort of bringing together of a lot of us who are going to be impacted by those sort of hostile interventions with normative, you know, just science-based work that will frankly, I think, be called into question in a way that never has been before. Over.
Well, I grew up in Chile. I will mention this because it was a dictatorial time, and part of the challenge, as I remember, when I was already a young adult, was to build on democracy and address the legacy of that dictatorship. And I mentioned this because in a dictatorship, there is suppression of freedom of expression. The political opponents are silenced and killed and persecuted, but the work doesn't stop. The struggle for justice and human rights doesn't stop. In fact, it becomes even more important in those times. And the turn that the United States may be heading to with the election of President Trump can present serious challenges in the line that you spoke about because of what has been in the previous administration, an assault on facts and evidence-based decision-making. And so that is certainly a cause for concern, and especially so with the increase in, some would say, the legitimization of disinformation. Mm-hmm. So the platforms that are used to spread disinformation, they have become quite entrenched in society and dominating public discourse, or the ability to shape that discourse. And so these are all very serious challenges. They point to a further need for involvement of certainly groups working on toxics and toxic policy. And those groups are, I would say, have been concerned about these issues for some time, and they have made quite significant inroads at various levels. There's a lot that should be done, but there are many groups and constituencies, I would say, that whose work is directly implicated by these findings and by these issues that have not been part of that conversation and that have not been part of that broader movement. And so I think that the biggest challenge is for those organizations to find ways to connect with the toxics, with the people working on toxics, with people working on human rights, on environment policy more generally, to address the serious findings that are compiled and analyzed in this report.
Other questions or comments? Yeah, Amanda.
Marcos, thank you so much for being here. I'm Amanda Klasing from Amnesty International USA. Can you talk to us why it's important to think about toxics from a human rights approach, and in particular toxics and gender? Like, what does a human rights approach bring to this conversation that maybe those that have been working in toxics or those that have been working on gender justice issues, what can be taken from a human rights lens, particularly your reports and the obligations that come with it?
Yeah, thanks. So one thought that comes to mind is that often when these kinds of issues, toxics issues, exposure, figures of premature mortality, incidence of cancers, they are addressed through a management lens. So, okay, so how much is clean? How clean can we get? What's the level of risk? What is a risk assessment telling us? And all of that approach is interesting and has informed environmental law and approach to toxics, but has been insufficient from the perspective of the individual or the community that suffers disproportionate impact to address the severe implications that toxic exposure has on the enjoyment of fundamental human rights. Because for the person that falls ill to cancer and loses her life, the right to life, what is the meaning of that? And so what is the promise and commitment of a country, of a state that pledges and commits to guarantee the right to life and to take all necessary measures, to take all steps necessary to safeguard that right, when it is, on the other hand, adopting measures that are enabling and encouraging at times, in respect of sacrifice zones, for example, situations that will result in people dying disproportionately in certain communities. And so the human rights lens brings into the frame the position of the individual and the community that suffers. It is not just an abstract exercise in managing numbers, it is also the vantage point of the individual and the communities on the one hand, and also brings into focus the hard international law obligations of states to take action. States are not bystanders or just simple observers in this process. They have commitments by virtue of international law, be it customary law or treaty law, to safeguard rights to life, right to health, right to a clean, healthy, and sustainable environment, among other rights, personal integrity, physical and mental health, the right to housing, the right to self-determination may be also implicated in certain instances. And so all of that brings together the human rights-based approach to toxics and the kinds of issues we're talking about.
It brings power to the issue.
Yes.
Please.
I'm Debra Erenberg, Women's Voices for the Earth. And I appreciate, and I noticed a lot of people taking notes when you mentioned that we really need more disaggregated data on impacts on women and girls. And Congresswoman Meng's introduced some great legislation to increase federal legislation, federal research along those lines. My concern about that is too often we see the call for more data as an excuse to delay taking protective action. And when we're doing like lobbying, we often hear that from industry, oh, there's no proof that this is actually harming people. And I was wondering if you could speak to, from a human rights lens, at what point do we know enough about how these things are harming us that while it's helpful to have more data, it's harmful to wait?
Yeah. No, that's a great point as well. Thank you for raising that. There is sufficient data to take action now, and waiting has a cost, not only for human rights protections, but also for
Welcome. Over on that side.
Hi, welcome.
Please come to the dock.
Yeah.
Grace,
your
now
words.
here.
No, she's great. Okay, well, we can have her come up.
Yeah.
Oh, the camera. We were right in the middle. Welcome, Congresswoman. We were right in the middle of Dr. Orellana answering a few questions on his report. So please continue.
So the question was, when do we have enough data, and when does waiting for additional data become a tactic for paralysis in order to maintain a status quo that benefits certain corporate interests? And I was mentioning that as the report documents and the sources establish, sources that are cited, we already have enough data to take action on these issues. So delay not only harms protections of human rights, it also imposes a social and economic cost on society that is significant. A couple other points. One is data. Speaking of Bhopal, one of the corollaries or consequences or outcomes, perhaps, of the Bhopal tragedy is that in the United States, where parent company was based, communities began to organize to demand the right to know what chemicals were being used in facilities in their communities. And as a result of that mobilization, US Congress adopted the Right to Know Act, which created the toxic release inventory. That model has been replicated with nuances in many countries of the Organization of Economic Cooperation and Development. So that brings in the right to access to information. I mention all of this because sometimes this confuses ends and means. The end is not to produce more information for the sake of publishing, for having more information, but for the purpose of prevention. And it is that connection between disaggregated data and prevention that allows for more targeted interventions that are at stake here, I would say. So I think you make a very good point on the harm of waiting. So one last consideration is science and science-based evidence, science-based decision-making needs to account for uncertainties and for gaps in knowledge. There's always going to be uncertainties given political realities, human conduct, given the limits of science. Science is a scientific, as a project, is unable to causally determine or to give information of causal connections of every single interaction of every single element in the world or in society. And so given these gaps, given uncertainty, given science as a continual gradual product of knowledge, construction and information, the need for precaution and precaution. And that's where human rights law brings in elements of policy that have been developed in other spheres of law, such as environmental law, international environmental law for that matter, in order to be able to afford concrete and adequate protections in situations of scientific uncertainty. In this regard, there are some elements of scientific uncertainty, but for the most, the evidence is already solid on the risks and harms caused and associated to exposure to certain of these chemicals that we're talking about.
We're going to
Thank
hear
you.
more from Dr. Orellana. Now I would like to welcome Congresswoman Grace Meng. Please, we're on the Zoom
Got it,
too,
got it.
so folks are very excited to see you. And I'm really happy that you're at our Human Rights Watch office. Thanks for coming.
I think it's my first time at the office.
Yeah.
It's very exciting.
Okay, well, I'm Nicole Wittersheim. I'm the deputy of the advocacy team here for Human Rights Watch. And the first thing we have to say is congratulations on your recent victory.
Oh, thank you.
Winning a 7th term in this current political climate, you are a true fighter and you're among other fighters, so you're in good company. Thank you so much for coming. We are happy that the 6th District of New York and all the women who need you in Congress that you won this race, and you are a true champion of reproductive health and gender equity. I want to just highlight very quickly just a few things that you're also very well known to our community for. You have been a true fighter against toxic pollution and the issues that we all care so deeply and are talking about today. You've sponsored bills, this has already come up, that would require ingredient labeling for menstrual products and menstrual products being more accessible and affordable for us all. Last year on Period Action Day, you introduced the Robin Danielson Menstrual Product and Intimate Care Product Safety Act of 2023. That's a mouthful. I don't know what's the acronym there. We love our acronyms in Washington. This would require the National Institutes of Health to study the makeup of menstrual and intimate care products, increasing research in the fragrance ingredients, colorants, dyes, and potential impacts that they may have on consumers. Your human rights leadership includes urging USAID to prioritize gender equality and empowerment of women and girls in their development programming around the world, and introducing bills to combat gender-biased violence and humanitarian emergencies across the globe. So please, once again, join me in welcoming Congressman Meng, and thank you so much for being here.
Good afternoon, everyone. Thank you, and apologies for interrupting the program, but it's great to be here with all of you. Thank you so much for the great work that you do every day, and also for the warm welcome. I'm Grace Meng. I come from Queens, New York, and it's such an honor to be here amongst all of you activists, advocates, and experts who are teaching our public about so many of these important issues and fighting for gender equality. Thank you to Dr. Orellana for your dedicated work, especially on this recent report. Thank you to Human Rights Watch, Amnesty International, and Women's Voices for the Earth for hosting this event and providing us with this platform to have today's discussion. As you all know, menstrual equity is an issue that has been a priority for me throughout my time in office. Menstrual health affects the lives of millions in New York, the US, and the entire world. Menstruation is a natural part of life for roughly half of the world's population at one point or another. Yet for many, the safety of the menstrual products that they use remains a critical concern. And that's why we're here today. Unfortunately, there are serious gaps when it comes to health and safety standards for different products used by women, especially from marginalized communities. As the doctor explains in his report, exposure to hazardous substances has gendered implications with women, girls, and many individuals who face health risks. Now, in light of recent findings about toxins in menstrual products specifically, I'm determined to ensure that we have stronger regulations of these products. Menstrual products are essential for the health of those who menstruate. And more than that, the quality of these products is essential for people's dignity and well-being as they participate in society. To ensure menstrual products are safe, we need more comprehensive research. That's why last year, as was mentioned, I introduced the Robin Danielson Menstrual Product and Intimate Care Product Safety Act. It is a long name. A true Democrat. Nice and long and detailed. The bill, yes. The bill would require the NIH to conduct necessary research on the makeup of these menstrual products. I really want to thank Women's Voices for the Earth for their endorsement of this bill and so appreciate your partnership so far in this push for menstrual equity. In addition to the bill, this past September, I led a letter with Congressmembers Summer Lee, Kathy Manning, and Ayanna Pressley, urging the FDA to urgently review and improve the safety standards for tampons. This letter followed a very concerning study by researchers from Columbia University, Berkeley, and Michigan State University, where it was found that 16 potentially toxic metals in tampons sold by over a dozen different brands. It's unacceptable that in the 21st century, products that are crucial to people's health contain toxic metals. And every day that we learn more, particularly thanks to the work of people like Dr. Orellana, who are conducting much needed research so we can better protect ourselves from toxins in the environment and in personal care products. We evidently have much more work to do. And I know that many of us are feeling the weight of recent elections, especially when it comes to issues of gender equity and reproductive justice. But now, more than ever, we need to continue this important work. Groups like yours do so much good work for our most vulnerable populations, and we have to continue to work together to protect women, girls, and many who are historically underserved. So thank you so much again for your commitment to a safer, cleaner, and more equitable world to all. I know that times are uncertain, but it's even more important that we stick together and amplify each other's voices. So thank you for having me.
We know you have to run, and we're very grateful that you were able to spend this time with us. It already has come up, this small topic of an election that has just occurred. And so if there's anything else that you could say that give us a charge, you were able to have a victory in light of what might become a very dark time. So we're concerned about, you mentioned the FDA, we're concerned about regulations, we're concerned about the battle of misinformation and disinformation on science. What are your plans?
Oh my goodness. I'm actually leaving this session early because our Democratic House leadership, they are holding a series of listening sessions from members and what we've heard. I think that personally, this has felt really confusing to me because I think when we came out of the 2016 election, when we last lost the White House, a lot of us, while devastated, were able to point to certain things that we knew we did wrong and that we needed to do better. And this time, it feels a little bit like everyone's at a loss. People have, factors here and there of how we may have lost the election. But there is nothing that overwhelmingly, not one factor that was evident that if we had done that, okay, the results would have been different. Like, is it really 10 different random reasons why we lost? We're still getting results from the popular vote. And I think because of the late returns from California, we are seeing that hopefully and maybe Kamala Harris will end up having won the popular vote, which is still comforting to know, but we're not there yet. So we are maybe hoping to get that number, California, when it's finished. But I comforted myself in the days before the election. I said that if I get too political, just tell me, but you brought it up.
No, this is a political crowd and these are good
I always
times.
be very composed, but you give me an opening.
Yeah.
So many thoughts. And
Yeah.
this is pre-listening
Yes,
session.
yeah.
I kept saying to myself, well, we have a ground game. They don't, right? I
Sure.
said that to myself so many times. I mean, all the excitement that was out there. But I realized that they had a ground game. It just wasn't evident to us. It wasn't through conventional ways. And that's why I feel, and I'll say this in closed settings, I feel like they outplayed us. I feel like kind of like we got scammed. And so, I'm hearing stories like things that we pride ourselves on being better at, like college student outreach, young people. I apparently, don't judge me, I listened to some Charlie Kirk podcasts. I really feel compelled to learn. And he was bragging about, and I had no idea about this group, Turning Points, where they recruit people from colleges in a nonpartisan way. Like, here's a scholarship, here's a free dinner, here's a free trip to Florida. We won't talk about anything conservative. And that's how they're building their pipeline. At ASU alone in Arizona, they registered thousands of people. Trump himself went to visit fraternities, right? So it's like, if Kamala had won, I wouldn't have brought any of this up, but we had gaps in our ground game too, in the battleground states. And he was also doing outreach events in blue states, in urban areas. And I think that even though it's not a battleground state, that coverage, like when he came to Madison Square Garden, got the attention of a lot of national and ethnic and smaller media outlets. It was free press coverage. And I can go on for an hour, but I think one of the last things that I've learned, or am trying to learn from, is that, and I say this to my team all the time, I paraphrase Maya Angelou, where people may forget what you said or do for someone, but they'll never forget how you made them feel. And I'm like, how do we make people feel like we did all that we said we did, right? Like, I had someone who works in the building where I live, and she said she's a single Black mom on food stamps. And she said, and I said, but the Biden-Harris administration did so much for you, right? We tried to change it's like so many lives. And she said, but you never understood me. Trump said what I was feeling. And I'm like, that's all he did. And then he turned around and did stuff that would hurt people like you. But they felt like he heard their concerns. So I think at the very least, we need to be better at showing empathy. We can't just brag that we're doing stuff for them. We have to show empathy and then, transition into what we're doing and be aspirational. Like, we're not done. We
No,
can say
we're not done.
Yeah. Right. So, okay, that's my really,
Okay.
you gave me an opening.
Well, yes, not, it's definitely related to all our
Yes.
topics, all our fights, all the
Yes.
things that we're pursuing for justice and human
Yeah.
rights. So,
But, and sorry,
thank you.
one last thing to add to your point and to your work, I think what is most compelling, because it's always a struggle for me sitting on the SFOP subcommittee to translate what is going on globally
Yes.
to back home.
Yeah.
And I think we need personal stories, right? Like, I just took a trip to Kenya and I came back and I said, did you know women have to walk like 10 kilometers to get fresh water, right? And real life stories like that versus just statistics and talking with
Right.
words like language that's in an omnibus, right?
Right.
We,
Yeah.
I don't let my staff use the word omnibus. It doesn't make sense.
All right.
So-
We'll keep that in mind and break it down.
Now that I've.
Okay. Well, thank you again so much.
Thank you.
It inspired-
I think it's also worth it to include more communities of faith and other real life constituent groups that can push some of what you're working on, right? Because it can't just come from us. Okay, thank you.
Thank
We'll be
you.
fine.
Okay, so now we're going to pivot to our panel. And I should have said this earlier, but you do have the bios of all of our experts that are going to talk today. On the panel, we have Amanda Klasing from Amnesty International and also from Human Rights Watch. And I'm going to ask you all to come up and join me, and I'm going to leave and give you a spot. And then LaTricea, is that LaTricea Adams from Young, Gifted, and Green. Are you from, are you located here in the
We're in
DMV
different
or?
places, so yeah, DC,
Okay.
Maryland, the Baltimore area, Flint, Michigan, and Memphis.
Great,
Yep.
okay. And then Debra Erenberg, we've heard from you, Women's Voices for Earth. And then Dr. Orellana is also going to join the panel. So please come up here so our friends on Zoom can see you. We're going to be a little tight. Oh, I'll give you, yeah, sorry. Okay. And then also, again, help yourself to refreshments in the back area here. So we don't have to pack them away. Let's see. Yeah. So far, I thank you all. Amanda, if you could come in a little bit, you're still
Come in a little bit
screen.
more.
Yeah. Yeah.
Sure. Great.
Okay. All right.
Thank
Great.
you, Nicole.
All right.
Thanks so much. I'm so grateful for this opportunity to actually moderate this panel because, as Nicole said, Human Rights Watch was my former home for 13 years. I am proudly a board member of Women's Voices for the Earth, and we'll talk a little bit about how important their scientific investigations are and the work that they do to build power. I have been so grateful for the work that LaTricea has done for the community more generally around the rights to water and sanitation, beginning in Flint and building out into incredible work, including building on the environmental justice work of this current administration and hopefully into the future. And Dr. Orellana was a colleague of mine and so grateful to see this work come to fruition. So I can't wait to dig into questions, but first I'm going to ask each of you to introduce a little bit about how your work relates to the issues addressed in the report. So I'll start with you, LaTricea.
Sure. Thank you for the introduction, and I'm really excited. Wait, let me take this off so you can hear me. I do have a teacher voice, so I hope that you all can hear me in the room and online. But this work for me is very personal. So while my work in the EJ movement started in the wake of the Flint water crisis, I am from Memphis, Tennessee, which now at this point has the largest population of Black folks in the country. It was in Detroit, but we kind of tipped over a little bit with that. The reason why that is important to note is with Memphis being a historically Black city, it is not shy from redlining. If we're not familiar with redlining is, essentially it was historical discrimination where essentially people in power essentially said where Black folks could live. Also growing up in Memphis, there's still remnants of Jim Crow. So where my parents are from, Riverside, which is a community in South Memphis, in the middle of this residential community is the Valero refinery. So literally you can walk outside on your porch and see smokestacks. So we're not talking about like miles away, literally across the street. There's also a park that is right next door to this refinery. Why that's important to me and personal, I have fibroids. I also have nodules on my thyroid. My mother also has fibroids and had historical issues with maternity. I'm the only child, not by choice, but by circumstance. So I bring that in the work that I do because it is inherently very personal and very much so reflective of lots of people, not just in my family, but with people who look just like me. And Memphis is not a microcosm, right? So it happens in cities who are very similar with similar backgrounds in cities industry, where essentially for since decades past, there has been a priority over profit over people. And so I'm really excited, despite to be able to bring that personal narrative. In the previous conversation, Congresswoman Meng talked about the importance of storytelling. And I think that's really compelling when we talk about this, where we can't say that it's fake news when we talk about my body and my womb and the communities that we work with. So essentially, in addition to my own personal struggles and working with communities that have similar struggles with water quality, is oftentimes not thought of as a reproductive health issue. Where I learned about that for the first time is actually in the wake of the Flint water crisis. I mentioned I used to be a teacher, so all my student loans represent K through 12 education. Dedicated my life to working with youth at one point for 16 years, even though I'm 25. But in Flint, Michigan is where I really just recognize how it is so intersectional between the water that we drink and our womb. So literally through the wake of the Flint water crisis, we learned about how literally before children were born, they had been poisoned. And if we take it a bit further and even think about this from an epidemiology perspective and epigenetics, thinking about that literally women who were impacted by the Flint water crisis, not only were their children that they were carrying impacted, but if you had a girl, that also impacts her and it keeps going. It literally transcends from generation to generation. And so that inspires me to do the work that I do and go beyond just like water quality, what are the implications around climate change and the intersections with corporations that are not good neighbors and are polluters, and how that impacts the ability to give birth. And even beyond, if you want to have a baby, there are also implications with reproductive health that are at stake as well, just with your overall well-being. But I know we're short on time. I can go for many, many hours talking about this, but that is my entry point into this work and why it's so important.
Thank you so much. Debra, can you talk a little bit about how Weave works on Women's Justice for the Earth? The short acronym is Weave. I guess it's not even an acronym, it's just the short form. Can you talk a little bit about Weave's work and how it intersects with the findings in the Special Rapporteur's report?
Yeah, so Women's Voices for the Earth, we work at the intersection of toxics, gender justice, and other forms of social justice. And our work particularly focuses on products that are marketed to women traditionally. So we work on menstrual equity, safe intimate care products, removing toxic chemicals from cleaning products, beauty products in particular. And our work includes research looking at what are the toxic chemicals that are found in commonly used products, and then education and advocacy to both empower consumers with information to make their own choices, but also recognizing that this is a systemic issue and we can't just shop our way out of this crisis. We need action by government. We need responsibility by corporations. So a couple of examples for those of you in the room, there's actually some handouts in the back with a couple of our current reproductive health related campaigns. Summer's Eve, which is the largest maker of intimate care products in the country, possibly the world, I don't really know, has come out with a series of daily use cleansers that contain boric acid, which is a known reproductive toxicant, should not be used on a daily basis by anybody, certainly not coming in contact with the vaginal microbiome, which when we've talked about like the absence of research and evidence, we know that this is a particularly absorptive part of the body, but there's been little to no research into what that actually means for our health when we're exposed to toxins. So we've called on Summer's Eve to remove boric acid and other toxic ingredients from their products. We ask you to join us in taking action on that. And that in particular isn't just a gender justice issue, it's also a racial justice issue because of matters of stigma in which in particularly Black women and girls are told that their bodies don't smell the way they should. The companies are kind of taking advantage of that and reinforcing those stigmas. And that's why we see in particular disproportionate use of these products among Black women and disproportionate exposures to those toxic chemicals as a result. The second action that's back there is we filed a citizen petition to ask the FDA to come out with guidance for companies on how to produce products that are actually safe for the vaginal microbiome. This is an area of regulation that the FDA should be taking action on, and they have not, which allows Summer's Eve to say, we're working in accordance with every known regulation and standard. So these are two very interconnected actions. We'd love for you to file comments in support of that FDA citizen petition and join us in taking these actions.
Great, thank you so much, Debra. And I just want to open up with a question for Dr. Orellana. Just thinking about the report and putting it together and the efforts that it took, do you believe that there is sufficient understanding among policymakers, among the human rights community, and among states more generally about these intersections between reproductive health issues and toxics?
Thanks, Amanda. And I think the answer is quite plain and no, there's not sufficient understanding. And that's part of what this mandate is intended and designed to do. Perhaps I could take a step back and point out, as I mentioned earlier, that the mandate, the Special Procedure of Human Rights Council is intended to monitor and report. Monitoring and reporting on the implications for human rights of exposure to hazardous substances and wastes. It is a global mandate. And so in that sense, there is a lot going on around the world to report on, unfortunately. So many examples could be given. But at that global scale, policymakers do need to make the connections that you're pointing to. And one of the places where those connections are made is in addressing gaps and shortcomings of existing instruments or areas where there should be an instrument, but there isn't. So I'll give two examples on that. One is on the Minamata Convention on Mercury, which was, it's the youngest in the family of multilateral environmental agreements. I started looking at the issue of small-scale gold mine because of the serious environmental injustices perpetrated not only against indigenous peoples that depend for material, spiritual sustenance on the rivers and yet are being contaminated by activities, mining activities upstream, but also on the miners themselves who often live in poverty. Into that work, then quickly found out about mercury containing creams and the big problem of pigmentocracy in many countries. And so much work is being done at the Mercury Convention level, but there's no doubt insufficient understanding of the intersections that that connect exposure to what is a known neurotoxic and hazardous element such as mercury, and the disproportionate impact on a segment of the population that is incredibly large and yet often invisibilized because of in this regard. So that's one example that I'd mentioned, and the other is on plastics. Early in my tenure, I was appointed by the Human Rights Council in August 2020 for 3 years. It's a renewable mandate for 6 years total. So now there's about a year and a half left for me in this role. So early on, I set out to produce a report on the impacts of the stages of the plastic cycle on human rights, noting that there are gaps and shortcomings in this area, and that helped move the needle and push for the negotiations of a legally binding instrument in this regard. Negotiations have been ongoing for some time now, a year and a bit more. Next, in a couple of weeks, the last scheduled session of the Intergovernmental Negotiating Committee tasked with producing an agreement is scheduled for in Busan, South Korea. I mention all of this because plastics, they're not just fossil fuels combined and mixed, they also have so many chemicals in them. And one of the chemicals that is routinely added is phthalates, or they're plasticizers for plastics to be more they're soft or
Malleable.
they can malleable. Thank you. That's the word. So phthalates, they're also a known endocrine disruptor, which, as I was mentioning earlier, affects women and girls in disproportionate manners given physiology. Phthalates, because of plastic production increasing, they are everywhere, and they may not be persistent like other elements like PFAS, for example, called forever chemicals, but they stick around, and if the tap is not turned off, they do accumulate. So the exposure is a cause for concern. Several phthalates have been identified as carcinogenic and restricted, and yet because of the nature of plastic trade and its composition, this is not a problem that any one country alone can address. And so the global dimension and having effective solution calls for the intersections that you're mentioning, Amanda, to be brought to the attention of the negotiators of this international instrument.
That's really helpful, and it raises so many points that I want to dig into. I mean, I think there are a couple of elements of the policymakers not making these connections, and then what it means to be an individual in a community. And so questions that I have for both you, LaTricea and Debra, is we've talked about access to information at a personal level. People, if they know more, maybe they'll make different choices as consumers, right? So access to information, like what Congresswoman Meng wants to do to have detox the box, so you actually know what is in your product. That's a really important point to reduce your exposure. But just thinking about what happens with these everywhere and forever chemicals, people have a fatalistic response. If it's everywhere, what is there to be done about it? And so how do we kind of combat some of that increasing emotional kind of response that there's not anything to be done with the guilt and pain that people feel that they are continuing to expose their children to chemicals, or their family members, or their communities, or even themselves, because there's nothing to be done. So maybe you could talk first because you've lived firsthand people being told about the exposure and then having to wait for policymakers to respond. What does that look like and how do we overcome that?
Yeah, so I think one of the tactics from a education perspective is we can't live in doom and gloom. I think part of the schema of public education is also educating people about alternatives. So this is very important while we start to see like more databases where you can type things in to see like, ooh, what are the contents of this particular, like I think about EWG, I know we love acronyms, for example, you can type things in to see like what the contents are, but then also thinking more intentionally about what are my alternatives? We're moving forward. How can I be more proactive to minimize my exposure? That's one part. The other part that I think is really important and is a victory that we don't really think about. I think about with this administration, literally like naming like PFAS is an issue. We are doing our due diligence to increase research and science that is solely dedicated to amplifying this issue. To hear that from EPA, a regulatory entity, is a win. Now, I don't know what the future holds. I'm trying not to think about that in this moment, but at least like for right now, that does position people in the local community to be more judicious in decision making. So I'll give you an example. So water quality. So water is like my thing. So when I think about water quality, for example, and I think about industry and those local decision-making bodies. So I think about recently, and this was actually in Memphis, for example, there was a developer that currently owns a landfill, but wanted to expand this landfill within 500 feet of an elementary school. Now it's pretty disgusting for you to want to do that, but you know, the way the democracy works, they still had to go through a process where people had to make a decision. So what we saw was you had people to not just try to move that decision-making body through a moral compass. Of course, it's insane that you would put a landfill beside an elementary school, but we literally had people to bring in the facts, to bring in data to say, yes, like this is immoral, but then talking about like some of the byproducts that come from a landfill. So some PFAS was something that was mentioned and the implications that has on groundwater. And so it was beautiful chaos to see like a marriage between talking about RJ through the intersection of and maternal health with science, talking about like these are the implications like on reproductive health, even beyond just like this just being insidious. So there's still, even though it seems bleak, there is still some sense of optimism around having an educated populace and bringing that in to both educate those decision makers and hopefully at some point creating a paradigm shift where that is always front of mind with those decision makers, that when you are like presented, like if you're on a land use control board, for example, ooh, that's a big one. Do you have enough like knowledge, a knowledge base and foundation where you're thinking about like PFAs and phthalates and all of these various things in your decision making when you do have industry that is trying to come into your particular district or what have you.
That's really helpful. And I think that brings us back to the idea. I mean, we're all 501c3s. We're nonpartisan and we don't want to cede the ground that human rights, the right to live in a toxic-free future is somehow not universal. I think people want their families, their communities to be safe, healthy, and to be able to have children if they want to have children, to have those children be healthy. With that in mind, Debra, what are some of the ways that it is difficult to find out what is in products that people use, and how do organizations like Weave have to actually do the investigative work?
It's difficult to find out both the ingredients and whether or not those ingredients might be harmful. You know, I think that most consumers in this country just make the assumption that if something is allowed to be sold, it must have been proven safe, when in fact the opposite is true. If it hasn't been proven harmful, and sometimes even if it is, it's still going to wind up on the shelf somewhere. And unfortunately, particularly in communities that don't have access to fresh and healthy foods, other, where perhaps the only store is some form of a dollar store where many of the products contain toxic ingredients. And for things like that, I think being able to find information, like a lot of the things that, our grandmothers use were healthy and safe alternatives. Like when we clean our homes, we can use vinegar and baking soda. We don't have to use a product that contains a toxic fragrance and bleach and things that are going to cause us health issues. Another thing that is really kind of giving me hope, even if we're not seeing a lot of opportunity for action at the federal level, is that there are states that are mobilizing around these issues and are taking action. And so just a couple of years ago, New York passed a law requiring ingredient labeling on menstrual products. And that has opened up information about menstrual product ingredients across the country. This year, 7 states passed bans on PFAS and other toxic chemicals in menstrual products. And Minnesota's law will be the first one that actually comes online. That one will go into effect in January of 2025. They also passed bans on PFAS in cookware, cleaning products, beauty products, and other consumer products. So as these laws come into effect in various states, most companies aren't going to reformulate products to cross state lines. So we should be seeing an advent of healthier products for consumers across the country.
That's helpful.
That's where
That's
I'm finding some
helpful.
hope.
Thank you, Debra. I want to bring Skye Wheeler, who is a senior researcher at Human Rights Watch and has been working on these issues. I wanted to bring you into the conversation. Well, also because of the amazing work you put to bring us all together today, but also help us understand in this kind of environment where we're concerned about resources being constrained, in an environment where we have high rates of maternal mortality in the United States. Is there a policy hook in exposing that word, the intersection between toxics and reproductive health in a way that can give all policymakers a pathway forward, thinking about low birth weights, thinking about maternal mortality and infant mortality? Is there something here that gives interventions or a way that we can start to address these broader issues?
Yeah, I mean, I think it's a question of not so much if, but when. I think our grandchildren will be shocked and alarmed at what we considered acceptable in this regard. But yeah, I mean, I think, doulas are a really interesting example of where an intervention has been proven not only to improve outcome, but also in that instance, also reduce costs for managed care organizations and the insurance companies that make money out of that. I mean, that would be an example, right? Like if we're serious about reducing premature birth, which is an extremely high cost on the maternal health, indeed the whole health system in the US, costs billions of dollars every year. And causes obviously also like lifelong health consequences for those kids, and also much heartache as well. We have to look at all the different ways in which, preterm birth is happening and then address them, right? And you have to take the opportunities where you can find them. So spend millions of dollars on X or Y, but we're also like just completely missing this whole environmental, that we could move the needle if we could reduce, toxic exposure. But I think there's just like a total failure of the whole space, frankly, and it's not just, the government. It's also like the big maternal health organizations. It's like the big reproductive rights organizations, across this country, internationally, just totally failed to see that, there's like this major issue, which is the right to clean and healthy environment that underlies other reproductive rights and health. So who knows what can be won through this, because we're not even trying right now. We're not even like seeing the opportunity of improving health. We're just like not even seeing it. So yeah, I think there are huge gains.
Well, on the idea that there are gains and opportunities and what is, unfortunately, from the Special Rapporteur, a very depressing outlook. I'm conscious of time, and I do want to leave us with kind of building on that hope. What are these opportunities? Like, we are entering a period of time where there may be deregulation. There will be attacks on sexual and reproductive health and rights. And what is a opportunity to take action now, and how can we encourage people to take that action?
So I would say that it's still power at the local level and at the state level as well. Especially with this incoming administration, they love saying to give power back to the states. Well, then let's states have that power. So I want to uplift, for example, like even though things went in a different direction, but I think about the state of Michigan and Governor Whitmer and the leaps and bounds that she's made with emphasizing and amplifying maternal health, specifically like Black maternal health, and just really taking a look in a mirror at the state of Michigan and saying that we have a problem, and then how do we allocate resources? I think about even in a not so progressive state like the state of Tennessee, where we have Senator London Lamar, who works really diligently to make maternal health just not a partisan issue. Mm-hmm. So her even being able in a very staunchly GOP state to get just even research done is a big deal in a state like Tennessee. So that's my call to action / outs of hope is to really continue to mobilize and use the strength from a local perspective, because that's where we can really harness a lot of power.
Thank you, LaTricea. Debra?
So in addition to state action and consumer action, my hope is all in movement building and solidarity and working together. And that's one of the things that I really love about this event, this report, is it really recognizes that environmental health, gender equity, reproductive justice, environmental justice, climate justice, it's all the same issue. Mm-hmm. And the more opportunities like this where we can come together, start speaking the same language, and looking at where there are opportunities to stand with each other and for each other, I think that's how we're going to get through this.
And Dr. Orellana, what would you like to see happen with your report? What can we take forward out of this room to build on the recommendations and the opportunities you see globally?
Thanks, Amanda. I have two thoughts. One is a reflection on what Debra was mentioning earlier about potential gains and how the impacts on the market can have multiplier effects. I recently concluded a country visit to Samoa. Samoa, like many other small island states in the Pacific, is import dependent. It does not have the economies of scale to determine product design or otherwise. And so the kinds of impacts that you're referring to will not, sure, in this program, we're focusing on US policy, but there is a multiplier effect around the world, and we are facing a global issue. So that's a first reaction. And secondly, and lastly, one of the elements, the theory of change, as it were, with the tools that monitoring and reporting procedures employ, so a thematic report, just that on gender and toxics, is to put a tool in the hands of people like yourselves that can then use it in your work as you see fit or consider using it. And so the best I can hope for is for people to exactly do that, to come together using this report to find common grounds and to find the kind of empowerment that you were also speaking about. Because in the times that we face, the local, the state level, the regional empowerment are the keys to overcoming what could be dark times.
Thank you so much. So I think that in the moment, we as policymakers have a role to play to continue to push where we can, to bring in the intersections and the intersectionality of how these choices harm both marginalized communities and communities of color in the United States, but also around the world because of choices and consumer choices and export choices that are made here. So we have our work to do there. And then there's the personal, the consumer choices that we make. If we choose to actually, go to the businesses that have already started to make the changes, make it so that it is profitable or not profitable to harm communities, then that's a personal choice that we can also make. Because I think we're all looking for the ways that we can control what we can control. I am so grateful for everybody's time. I'm grateful for the work that everybody has done on this report and on this issue more broadly. And I am grateful for all of you that have joined us today. I hope that there are connections that can be made to move forward with this important work and really think about how to integrate those of you from the RJ, the reproductive rights, the environmental justice and the racial justice lens, how we can work together to bring forth change in this particular area, because it is generational impacts and opportunities for generational change. So thank you all, and thank you Human Rights Watch for hosting us today.